The ultimate men's movement with our host, Dr. Jack Rocco from the Ultimate Men's Clinic in New Bedford, Connecticut. How are you, sir?
And I'm great, Neil. What do you think of my new background?
I love it. It's great, but you could have that own office and stuff. We had to work on some technical stuff, but I have my own technical questions for the doctor. I've been on the testosterone replacement therapy and I've chosen it. I didn't need to go on it. I was just average and I said, I don't want to be average.
It's, like I said, the primary indication for testosterone replacement is typically symptoms. The patients will come to the office with specific symptoms. Neil, if you don't mind getting personal, do you mind?
Yeah, I'll get personal, but I don't want to be average. I'll be honest. I don't know if you're supposed to do this on the podcast. I don't give a shit. I'm 435 over 1,000. And I'm
your level was 430.
Which is considered the average range, F average.
See, it's a multifactorial. The reasons why someone may or may not be symptomatic depends a lot of times on the receptors that you have and how full those receptors are and what your baseline is. So it's probably a little bit above the conversation today. We try to keep it light and fresh, but I would say, like I said, the primary reason to get on testosterone is that you are having symptoms of low T, okay? Typically those symptoms are a decreased libido, just fatigue, tiredness, increase in weight, brain fog. Some of these symptoms are a sense of weakness.
See, I go by the Dave Asprey way, okay? And the reason why I chose it, because I want to be at optimal level in everything. And
I agree.
The research that's come out about testosterone, if you take the testosterone replacement therapy, it's just like BHRT for women, that ultimately, or, the hormone replacement for women, that ultimately they don't want to deal with some of those symptoms. I want to be what I felt like in my 30s and 20s. And that's more
I think it's, like I said, the symptoms are sometimes vague, but you got to understand, Neil, I'm a doctor, okay? And we're held to a standard that Dave Asprey isn't. I've had to take that Hippocratic Oath.
Have you? Okay, but you
have a responsibility.
But I'm not low T, but I'm average.
You are very close to low T.
Right, exactly. And so what I would say, now I'm going to talk about the symptoms since I've been on it. Okay.
Okay.
All right.
So like I said,
so this is going to be a really interesting reels I'm going to be effing putting together, because honestly, I'm putting myself out there and I'm going to continue to tell the story.
Yeah.
But see, you're right. You say as a doctor, your Hippocratic Oath, and this is where we can go in the controversy, right? Because ultimately there are doctors writing the deals that are writing for hormone replacement therapy, or let's say we're talking something different. We're talking testosterone replacement therapy, where if you go to a functional medicine doctor, you're not on that level. They'll write it for you, even if you're higher.
Yeah, Neil, I've always been honest. I think that's my biggest flaw. That really is. Like, I am painfully honest and I have pissed off many patients.
I don't want to lose it, man, because
in general, like I said, I have to go with my heart. I have to go with my training. I don't want to harm anyone. Right. I have no intention.
But the research that came out there, according to, and then we have to ask ChatGPT this question. So I got to teach you the voice chat. Like Dave Asprey said, that ultimately all that was bullshit that came out.
About the heart health.
Yeah.
The powers that be have changed a lot of their statements. And I think we're at the point, because
I got 3 minutes with the doctor, so let me ask these questions.
All right,
so this is what I've been seeing, and we'll do part 2 next week or another time, because I want to do more podcasts all day long about this, because this is controversial or good. People want to learn about this testosterone replacement. What have I been seeing so far? What I've been seeing so far is that I am feeling more energy, even more than I am, because people say, Neil, you already have more energy than any 50-year-old I know running freaking a business and working 16 hours plus a day, and you still are rolling. The second thing I'm seeing in the process is definitely more focus, way more focus, I'm not losing as much of the remembering of certain people's names. I'm staying more focused in my conversations. And also, I'm feeling younger. I'm feeling more, I would say, the libido side, but also just feeling like I don't have to, it just feels, I feel like pumped up is unbelievable. And it's from like when I used to do the yoga, but now I'm feeling the flex and I'm going out and walking my dog, and I don't.
And that's gonna continue, and that's gonna get better. If you have time,
how long does it take to get to that optimal level?
I would imagine you probably start balancing around the 3-month point, but
we're only a couple weeks in, so
you've only been on, I think, 2 weeks or so.
Right.
From what I remember. And like I said, when I got started on it, I would say the same thing. It was my mental acuity first. It was just that mojo. This most recent time when I went back on it, I was doing lipo. And that's a pretty intense physical activity, but it can get a little mundane. And I'm just saying, as soon as I went back on it, I just felt the mojo. I just felt like I was energized. I could do it all day long. It wasn't fatiguing to me. But a lot of it was definitely the mental acuity. I was less cranky.
But I also
I don't know if you ever get
more
cranky.
hungry. So when I'm doing my, since I've been doing it, it's harder to fast with testosterone replacement therapy. Is
Harder
that
to fast.
true?
You feel hungry?
Yeah.
You probably do. It's probably increased your metabolism a little bit.
Really? Okay.
Yeah,
So,
it probably has increased your metabolism a little bit. You're probably burning fat. Your glucose level may be changing. You're getting to a set point. I think eventually you may calm down a little bit and you can control your diet a little more. You should start losing some of that belly fat.
I already am.
Yeah, with the increased metabolism, you should start losing some belly fat.
I don't have much of a belly fat left.
Yeah, but I said if you worked out, the amount of effort to gains in the gym.
It's easier. I only use yoga and flexing, and it works for me.
You should feel your muscles.
I already felt they were present, but now I feel.
I know you're a specimen, Neil.
No, I wish it was a specimen.
You need to donate that body.
Your buddy who sent us that stuff. Remember, he's frigging crushed. The dude that sent us the pictures and text messages, he looks unbelievable. Remember,
Jeff, the guy who lost the weight?
No,
John Rupp, my friend John Rupp.
Oh yeah,
that dude's
a specimen. I have to hit the weights, but I need to get some power cuffs from Diamond Dallas Page's power cuffs. He just did a post. You follow Diamond Dallas Page, DDP from WWE and all that stuff. Dude just showed a picture of him at 69. That's where I want to be at 69.
Oh, you got to work out too. It's not going to just happen naturally. Yoga, then whatever you want.
Then I work out with yoga, bro.
I am not
I'll have to show you some picture without my shirt on. What is that the next thing I got to do?
Please don't, Neil. Please don't.
No, yes. So that's the thing, but not on this show, but I never got that on a podcast.
Yeah.
There we go. No.
We need to get some.
So I have a interview with Gilda next. But so that's the goal. But what I've noticed is when I did that and I did the flex, I'm like, holy cow. And I'm probably building muscle. And that's probably what my weight, because I hit the scale. I'm on the scale about 280. I've gained a couple pounds. So I'm asking.
It's muscle. You should start to burn some of the fat. I said, I can't.
When I walk with Chewy, where I'm talking on the podcast, I learned this from one of my clients. You were on a Laura Ribbons show. Flex all the time. And so my legs are all this stuff, because I know that talk about that, Doc, last thing about flexing. If you flex all the time, can you build?
Absolutely. There's a difference between the words, the medical words are isometric versus isotonic. And isotonic is you keep the same tone. It's more like moving weights. But isometric is when you're just pushing. This is isometric.
Right.
Maintaining the same.
So let me show you Diamond Dallas Page's DDPY yoga. You start it like you're going to grab a ball, and you put it so you grab the ball, you put it all the way up like this, go down a T, you put a T like this, you're pushing.
Right.
When all the way up, hold it up. And I'm not, I could keep going all day long. Flex. No problem.
But what happens, Neil, when you're let me give you the medical, that's where my brain works at the microscopic level. When you're contracting your muscles, the nerves are sending signals to the motor end plate. So your nerves from your brain are sending nerve signals into the muscle. The muscle will then react. But while the muscle is contracting, it's also receiving trophic signals from the nerve, which causes the muscle to hypertrophy or to increase. So whether anytime you're flexing, anytime your nerves, or even with electrical stimulation, it's better with your nerves. As your nerves are firing and your muscle is flexing, you're getting trophic signals, which mean to increase the size of the muscle.
When I'm walking my day, I'm flexing all the time with Chewy. And then when I'm on the podcast or I'm doing a yoga pose, DDPs is amazing.
You honestly should. You should take a photo. You should do it before and after. You've been on it short enough time.
Yeah.
Take a before pic in the mirror. And then in 3 months, and do another before.
Guess who's trying to call me now? Gilda.
Okay.
Well, so there you go. But I love this. This is a great part of the podcast. Thanks for the doctor visit. Go to the ultimatemensclinic.com and check out the Ultimate Men's Movement. That was a special simulcast of the Neil Haley Show and the Ultimate Men's Movement, guys. Take care.